channel. You're watching The Brown Feminist. In today's episode, I will be telling you guys about why I chose to go to nursing school as a second career in my 30s. I'll be telling you about all the pros and cons that I weighed before making this life-changing decision. So, without further ado, let's get into it. Now, making a major change in our careers, well into our 20s and 30s, is becoming increasingly common. One of the reasons is that what we thought we were passionate about in our teenage years or our early 20s doesn't really pan out that way. Either we come to figure out after joining the workforce that we don't really love the actual job, or we realize the job market and opportunities is not what we thought it was going to be. The market and the world is also constantly evolving, and the need for different positions and different skill sets are also changing. That could also be a reason why you're considering a second career. So now let me go into a little bit about why I decided, weighing a lot of pros and cons, why nursing school would be the best second career for me, and how I ended up making this decision and what happened after. So for those of you who don't know, I actually had a background in basic science. And what that means is that I specialized in medical science research within wet lab settings. I did my bachelor's in biochemistry, biotechnology. I did my master's in viral immunology. And I was doing a pretty good job working within a laboratory setting and publishing research papers and so on. But soon enough, I realized that being within a lab setting, where I would be destined to spend at least the next 5 or 10 years of my PhD and postdoctoral fellowships within maybe a level 2 or level 3 biosafety labs and working with tissue cultures and various other assays, that really wasn't what I wanted to do. I was passionate about seeing the clinical impact of my work, and oftentimes people who do basic science research, while there is a lot of groundbreaking stuff, it does take a long time to translate to the bedside and to see the clinical impact of your work. So for me as a person, it was really important to me that I see more instant results. So I thought I should move to a more clinical scenario. And that's what brought me to start questioning what clinical scenarios or what clinical careers are actually available to me. And at that stage of my life, I was already in my late 20s. Which one would be the quickest, the fastest, that could help me gain the skills necessary and put me to work as soon as possible? Now, I will give you 8 reasons why I chose to do nursing school in my late 20s and leading into my early 30s as my second career, and all the benefits that I realized were coming from it. So, number 1. The first thing is I already had a strong background in research because I was coming in from the biomedical research world, and I did enjoy research. It's not that I have any issues with it. I really do enjoy having a hypothesis and finding out whether it's true or false and finding out new discoveries. So I did want that portion to carry on. But what I wanted to do was move more into clinical research, into drug trials, into research with human subjects. So I found it quite difficult to transition from my biomedical sciences background into a clinical research position without having some kind of exposure to working with patients, human subjects, vulnerable populations, knowing a lot about human ethics and all of that. So that was one thing that nursing school was also going to give me. It was going to give me exposure into the world of clinical research, research in nursing, qualitative and quantitative methods of research in nursing, and working with human populations and human subjects and all of the research ethics that goes around working with human subjects in your cohort. So all of that exposure was automatically going to come to me while I was working towards a clinical degree in nursing. So in the future, whether I wanted to work in a hospital or I wanted to work in clinical research and utilize some of my background in research as well, both doors would be open if I went to nursing school. So that was definitely one of the primary reasons that this was my good second career choice. Now, coming on to the second point, I wanted to work with people. And in a clinical setting, which means by going to nursing school, especially the 4-year registered nursing program that leads to a license, it allows a lot of growth clinically as well. In the long run, I have the opportunity to specialize. For example, I'm somebody who's always seeking that adrenaline rush in my work. So I could work in the ER, in a critical care setting, ICUs and NICUs if I wanted to, by becoming an advanced practice nurse, RN, or I could also go on and do a nurse practitioner's program later in my career and actually more independently and in more leadership positions also see my own patients, diagnose conditions, order tests and prescriptions, and have like a very one-on-one primary healthcare kind of provider relationship with my patients. So all of these opportunities that open up when you especially do the registered nursing program was excellent, because I wanted the option to just do the RN and work in a hospital. I wanted to have the doors open if I want to become a nurse practitioner in the future and work more independently. I wanted to have the research option to do a lot of clinical research if I wanted to. So all of these were pluses. Number 3. I wanted to make sure that in the long run, I had a lot of opportunity to reach leadership roles. And doing an RN actually opens up that door in so many different ways. Let me give you some key examples. If I did go down the clinical research route, then I could work my way up from a clinical research assistant, level 1, 2, and 3, a research associate, a clinical research coordinator, to a trial manager or project manager. So there is a good pathway for growth if I wanted. Secondly, if I wanted to go into academia, I could go ahead and do a master's PhD, and I could become a nursing professor. I could do my own research and have my own team that way. Thirdly, if I wanted to grow clinically, as I mentioned, I can do my nurse practitioner's degree afterwards. In the US, that is usually a doctorate, like a doctorate of nursing practice. In Canada, that is at a master's level, so it is even faster and easier to become a nurse practitioner if you have all of the other credentials for it. So in that way, by becoming a nurse practitioner, I would be also eligible to go into leadership roles. Nurse practitioners can also work in affiliation with hospital research institutes and clinical epidemiologists and run their own research projects, just like physicians. Nurses like RNs also can go into leadership positions in hospital administration and in health policy, join the government, and so much more. So going into leadership positions, these credentials, your clinical credentials of being a nurse practitioner, in addition to whatever you've done before, would be a huge help, and it would keep so many doors open for career growth. Number 4 is working in collaborative and transdisciplinary research teams. My cat is walking below me right now. Anyway, so when we're talking about working in collaborations with other healthcare professionals, I've seen that nurses in particular, or nurse practitioners and nursing academics, are able to do that a lot more seamlessly, a lot more easily than those of us who are coming in from basic science research. Although a lot of basic science scientists do collaborate with clinicians, I've seen that nurses are more readily creating these collaborations because they do have a clinical background and understanding. I myself have supported research where like an RN and a physician have worked together on a research grant. You can have the opportunity to work with physicians, physiotherapists, kinesiologists, and the kind of research that can take place when you're really doing transdisciplinary collaborative work with healthcare providers is really mind-blowing to me. And that is definitely like something I was very interested in. I wanted to come from a clinical background, so it was easier for me to do these collaborations in the future, to do very high impact healthcare research, to do high impact clinical research and clinical trials and all of that, where eventually I could go up into a leadership position, have my own research team, do more of my own grants and own publications and everything. So in general, it's easier when you come from a clinical background yourself to develop these strong collaborations with your colleagues in the clinical world and to do very interesting kind of transdisciplinary research when a nurse and a kinesiologist are like collaborating and the two worlds come together, and you can do like way more rare kind of research with your patient cohort than you could have otherwise. Now, as someone who does actively get bored of different careers, I wanted to go into a profession for my second career where, if God forbid I ever got bored, I had the opportunity to switch things up. And nursing is an excellent profession for that. If you are ever bored in the kind of nursing you're doing, for example, if you're working in mental health and you want to go ahead and work in a different kind of nursing, the switch is not that hard. On paper, there's not a lot of credentials that you need to make that switch. You don't need to go and do another master's. You don't need to go and do a lot of things. It's good to have a little bit of casual nursing experience in the fields that you're trying to transition to and maybe do a certification. But mostly, a lot of the training is given to you in school. So you can go ahead and become a mental health nurse, and after a few years, you can change and go to med surg. After a few years, you can change and go into geriatrics. Especially within hospital nursing and clinical nursing, whether you're transitioning from like long-term care to hospital care to peds, from peds to NICU, the transitions are a lot easier, especially if you have some kind of an advanced practice nursing certification and you're able to convince your employer who is doing your interview that I have all of these skills which are transferable and I'm willing to learn on the job. So I do personally know a lot of nurses who've done 5 years of this, they got bored and did 5 years of that. So the ability to transition within clinical roles was a big bonus and one of the reasons I considered going into nursing. But also along with that, even if you wanted to transition from your clinical role out of it to a management role, a consultant role, that is also pretty easy for nurses, especially in North America. For example, a lot of health tech companies are now hiring nursing consultants, and moving from your hospital clinical role to a role like that can be a lot of fun, can be a really big change and exactly what you're looking for. So all of these transitions also remain quite open and quite comparatively easier to do than if you're coming in from a different profession and you're moving around within specialties there. So nurses have a lot of option to do like administrative work, consultancy work for like a private company, going into clinics, going into hospital, changing specialties within that, whether it's within the clinical setting or between clinical and non-clinical settings. So there is a lot of option to switch things up. Number 6. Now, this is a very personal one, and of course it can vary and people might disagree with me, but I have personally felt, especially in Canada, that the respect that nurses get from the community, from patients, from the public is just, it's incomparable to anything else I've done. I've worked in research before, I've worked in private sector before, and I never felt the way that people treated me when I was working frontline during the pandemic. The kind of honor, the kind of respect, the kind of warmth we get. Nurses are the first faces that people see when they're going into surgery, when they're going into a hospital, when they're in extreme pain. They're the first people they reach out to for help. They're the first people they expect compassion from, and also the first people they thank with all their heart. I always get emotional when I think about this aspect of nursing, but it's very true. I recently had surgery, and I remember that when I was having surgery, the only person in the whole room that I wanted to find some comfort from was the scrub nurse. And I asked her as I was going under general anesthesia, like, will you please hold my hands as I'm passing out? And of course she did. And the amount of love and admiration and respect I have for nurses who are there for their patients is insane. And I can't wait to do more of that as I, become like a licensed clinical RN. Number 7 is something we all love and we all need, and that is the money. So being a nurse, being an RN in particular in Canada, it pays very well. And we do have a starting, it can be provincially regulated. For example, in Ontario, every nurse in their first year of practice has a scale, and they all get paid the same in their second year, third year. So it's all by number of years of experience. When you're working in a hospital, they can pay you a bonus of like 50 cents or $1 or $2 extra based on if you have your master's in nursing, if you have like a special certification. So that would be your premium. You can get paid more by doing more shifts. You can get paid more by doing night shifts. But in general, the starting salary is usually around $65,000 a year for RNs in Ontario if you're working in a hospital setting, and it'll keep going up like that. you also have the opportunity to work more and make more money on the side beyond your full-time job. But furthermore, if you're a nurse working in management role, for example, in long-term care, in assisted living facilities, in a private company, then you are able to negotiate your salary based on the work that you're doing, or your scale will then not just be regulated by the province, but there can be other mechanisms at play that you charge for your consultation or your service. But typically in a hospital setting, it's regulated by the decision that the union comes to with the province, and even then it's been quite excellent. I know a lot of Canadian nurses who also go ahead and travel. They do travel nursing in the United States and other places, and boom, there's a huge bump in your pay. It can almost double. It is a lot more like stressful, it's new, it's challenging, but if you're into that, it can be an excellent way to be a travel RN and to make a lot of money. I believe it ranges somewhere around $120,000 a year from your first year of being a travel nurse, and it just keeps going upwards as you specialize. Nurse practitioners, of course, make well above 100 grand in most places, depending on the setting. So there is a lot of good option to make a very stable, healthy living while doing really good work that you're passionate about. Number 8, the final point, is whether or not you have job security. In most places, especially in North America, there is an aging population, there is a sick population, and it's only going to get worse. So there's going to be more people aging, more people needing health support, more people getting sick and sicker. And that means that there will always be a need for nurses. Currently, there is a huge shortage of nurses throughout North America, particularly in Canada. And that means you will never be out of a job. And there's so much opportunity to do so much good work. Whether you're going to a rural community, you're in a busy city hospital, you're doing community level work, you will not be out of a job. It's pretty rare for a nurse, for an RN who's licensed, in good standing, to keep looking for months and months and not come up with a job. It's usually pretty straightforward, and you're usually able to find a job pretty quickly because there is such a shortage. So this final point is just that you will not be out of a job if you go to nursing school. Whether or not that's a teaching job, that's a hospital job, that's a community job, that's a long-term care job, but there are jobs out there. So being completely broke or unemployed, or just like your skill sets running out, or not being in sync with the technological revolution, that is much less likely to happen. Having said that, it's always good to stay on top of your game, to keep learning new tools that will keep making you an excellent nurse so you can provide great care for your patients. So there you have it, guys. Those were my 8 points of why I decided to go to nursing school, despite the few cons, which is having a lot of student debt now, which I never had before because I was doing my undergrad and grad school primarily on scholarships, and there was a lot more funding. But I would tell you not to worry about that. If you know that you're passionate about this, go for it. Paying back a student loan as a nurse is not the hardest thing in the world. I've seen many of my friends being able to do it quite easily because the starting salary is pretty good, and you can keep building your career and keep having a job security as well. So other than that, if you know some pros and cons that I haven't covered in this video, please do make sure to comment below. And if you enjoyed the content, if you thought it was helpful, then please do hit the like button and subscribe to my channel if you haven't already. It would really mean a lot to me. Thank you so much for watching. Until next time, this is the Brown Feminist.